Hello and welcome to the Health, Occupations, and Long-Term Care Subcommittee of the HGO Committee. We are meeting today to discuss 4 bills. We will be meeting until 12:30. So we're a little bit rushed, but many of these bills are familiar to us. The first bill we will be taking up is House Bill 173, State Board of Social Work Examiners, which is a Lisa bill, and Delegate Bagnall is the sponsor. Lisa, do you want to remind us again what this bill does, and then we'll go to Delegate Bagnall?
Sure. This bill authorizes the State Board of Social Work Examiners to issue a temporary license to an applicant who, except for passing the required examination, has otherwise completed the appropriate education and experience required for a license to practice bachelor social work or master social work. There is a reprint of amendments that was distributed, and the amendments require a temporary license holder to be supervised. They require an applicant for a temporary license to have a full license pending, and they require the board to adopt regulations regarding the process of obtaining a temporary license, the supervision requirements, any limitations on the provision of services, a time period for taking the examination, and any other regulations determined necessary by the board to ensure public safety.
Delegate Bagnall, do you want to give us an update?
I'll give you a very quick update. So these amendments represent multiple conversations between the stakeholders of the association and the board, and an attempt to address all of the concerns that were raised by the board. I believe at this time we are simply at a philosophical difference, because we passed this bill, I believe, unanimously out of committee last year, and we have since heavily amended it to try and address all of the concerns that were raised, not just in last year's hearings, but in the subsequent subcommittee hearing. And with that, I will turn it over to the advocates.
Okay, let's hear from Scott Tiffin, and then Delegate Collison, did you have a question first, or should we hear from Scott? You're on mute.
Thank you, Madam Chair. I have a question before we go to Scott.
Sure.
So in the amendments, Lisa, I think you said pending, and I wasn't sure what the pending meant. Pending what? In the amendments. I
mean, they have sent an application for full licensure to the board, and it's pending review.
But that, so the application, but that doesn't. It's not. But that wouldn't necessarily include the exam. Is that right?
Correct. Yeah. I mean, they might not have taken the exam. That's part of what's going to be in the regulations.
Right.
Scott might have some more information on exactly how they plan for this to work.
Okay. And it's still at the discretion of the board whether or not to do this, or okay. All right.
It's still a May issue.
Still a May. Okay. Thank you, Madam Chair.
Thank you. Let's hear from Scott. Do you have anything you want to add that is specific? I know you sent me a very good summary email, so maybe you can run through some of the points in that for the committee.
Yeah, for sure. I will try to be really quick. On Delegate Cullison's question, process-wise, how it works is you apply first, and then the board has to approve you to sit for the exam. And then after you get that approval, you take the exam and you give that proof to the board, and then you can get licensed. So I just wanted to really quickly go over a couple points that I think the amendments help address. One is that the amendment says that a temporary licensed social worker cannot represent themselves as a fully licensed social worker. And we understand that the public should be fully aware of who they're providing services from. And then there was another part of the amendment that allows the board to limit the types of services these folks can provide. I think there was some concern that maybe some of these folks shouldn't be doing psychotherapy, which is maybe like the top part of the social work license, but there's plenty of other services that social workers can provide that are not psychotherapy. And so we just wanted to give the board the option to maybe limit some services that they just really feel the exam is important for. And then another point I just wanted to really quickly highlight is that Mary Beth, who's our executive director from NASW, has been receiving about 2 to 3 calls a week since she's been here from folks who have been waiting an very extended period of time for licensure, some of which have been up to 6 months. You know, we understand the board is working really, really hard to get licensures back up to snuff, you know, based on the data breach and everything that's been going on around that. But we are deeply concerned that when the next cohort of graduates graduate, we may see another licensing crisis. And that is why the amendments give the board a little bit more flexibility on the times they can use these temporary licenses to ensure that whatever the next crisis is, they can properly address it. Hopefully there won't be a crisis when everyone graduates in a couple months, but the General Assembly is not going to be in session. And so we just feel that the board needs to have this tool. If they choose to not use it because they think everything is fine, that's great. I really, really hope everything is fine, but we're not going to be here to fix it if it's not. And so we just really think this is a belt and suspenders. I hate that phrase, but it's the first thing that comes to mind, bill to make sure we're good to go. And then finally, just wanted to sorry, go ahead. Sorry.
Oh, no, go ahead. Finally, go ahead.
I also want to reiterate one last point, which is that Maryland law already allows for certain social workers to practice without an exam. One being folks who are still in school can practice supervised. And then recently it came to my attention that in Comar, there's the option for folks who are licensed in other states to come into Maryland and practice. And that Comar explicitly says that they can have not taken the exam and they could be pending that exam for up to 5 months. This isn't just an intellectual question. There are states, for example, Illinois, that licenses social workers without taking the exam. So we are currently allowing Illinois social workers to come into Maryland pending exam, but we aren't allowing new graduates to continue practicing here in the state of Maryland. So those are the main points I want to talk about. But
Okay, and I want to go to Mr. Weinstein because I'm sure he has something to add as well. I just want to, before I go off of Scott, I think Delegate Cullison made this point, it's entirely voluntary. This is something the board would have to choose to do. And the point you just made was we just making a decision as to whether to give them this tool between now and the next session, should it be necessary, right? Okay, so let's hear from Mr. Weinstein. Hi, welcome. You're on mute.
You would think I'd know by now. My basic position is the same. The board continues to oppose this bill, and I think the amendments are misleading. These people have been required to be supervised since 1975. And the part of the statute that Mr. Tiffin referred to. I'm sorry.
Sorry about that.
Was it created in 1981, and it hasn't been used probably in 10 or 15 years that I'm aware of. And I checked to see what impact this bill is different than last year's bill because it's centered on 2 levels of licensure instead of 4. And so I looked closely to see what the impact is and how long does it take for the LBSW and LMSW to be licensed. If all the materials are in, it can take a week. If the materials are not in, it can take up to a month. It's not a complicated application in contrast to the advanced licensure of the LCSWC, which requires supervisor's notes, requires a description of the kind of work that's being done, and it can take a longer time. And the cyber attack really impacted those communications more than any other. But I've checked with the staff on a number of occasions. The 2 levels we're talking about can take within a month. I've been told within a week, but let's say within a month. So I don't think this bill is necessary for the intent that it was proposed. Last year was a different year because of this pandemic and the closing of testing. So, and again, the supervision, it's not new. Since 1975, you can't practice any social work without being supervised at those 2 levels. So that's the position of the board. We've thought a lot about it, and I understand what prompted this, but continue to say that the board is opposed.
Okay, thank you for clarifying that. Delegate Cullison.
Thank you, Madam Chair. So I understand the board's position, but I guess what I don't understand is why it's not useful to have a tool in a toolbox that you may need at some point. No one anticipated what was going to happen to us the last 2 years with COVID. We hope that it doesn't happen again. There's no disadvantage to having an extra tool. Given that thought, I would like to move favorable support for this bill 173, Madam Chair.
Okay, do we have a second?
Second.
Okay, the bill has been moved and seconded. Do we have discussion from the members on the bill? Delegates?
Thank you, Madam Chairman. I think you needed to move the amendments first.
Oh, that is smart. Thank you, Delegate Saab.
Well,
So
no,
I
I'm not supporting the bill, but I just want to do it the right way.
I move the amendments.
Okay. Moved and seconded on the amendments. Any discussion on the amendments, which Scott Tippin described to us? Delegate Morgan, is your hand on the amendments?
No, it's on the bill. So go ahead
Okay,
and move them.
let's adopt the amendments. So they've been moved and seconded. All in favor of the amendments, say aye. Put your hand up if you want to, you're okay with them. Okay. Anyone opposed to the amendments? Okay, the amendments are adopted unanimously. Now on the bill as amended, I'm going to assume it's been moved by Delegate Collison and seconded by
As
Delegate
amended.
Bagnall. And then we'll hear from Delegate Saab, who is smart about the amendments. Thank you. And then Delegate Morgan. Go ahead, Delegate Saab.
Thank you, Madam Chairman. So this is more to me as explaining my vote. And I think if we support this bill, and I understand it's another tool in the toolbox, and we hear that all the time, but I think a bill like this would undermine not just this board, but any future boards that we add more and more of this. And I think it just sets a bad precedent that we have these boards, we have these tests, and mental health is a big deal to me, and I know it's a big deal to the sponsor also. And I appreciate the intent of the bill. My concern is when we have, which we always listen to the experts on this, and the experts are telling us this is a bad move. And our job as policymakers is to listen to the experts in the boards and the association to deal with these things, because they know what negative impact or unintended consequence this bill will have. And I think it's just an unnecessary, and I'm hoping that this is a warning for the board to move things faster and expedite things. But passing a bill like this, I think it's just undermines the board. So it's just more of a statement and explaining my vote than really, because I know that ship has sailed. So
No, I appreciate it, Delegate Saab, and I think this is a bill we've pondered over all session, and we did pass last session. I think there are members on this committee who have a sort of a disagreement on this, and we don't usually do that on this subcommittee.
Right.
But Lisa, from the bill file, I just want to be clear. It is my understanding that while the board has remained in opposition to this, the other experts, the associations, the healthcare providers at the national level, no, they have not expressed concern about this, right?
Right. Yes.
All right. Delegate Morgan.
Thank you, Madam Chair. I just want to re-echo a lot of the same things Delegate Saab just said. I think this sets a bad precedence. There's many of us that disagree with and probably could vote for bills that reduce licensure. But this bill, since we have licensure, it seems like now we're creating a way to bypass it. So I think it's bad precedent. So I'm going to vote no on the bill.
Thank you, Delegate Morgan. Delegate Collison.
Yeah, and I hear the concern about the precedent setting, except that this is something that the board will choose to use or not. So, it is up to them in the final analysis, because of the way the bill is written, they get to choose whether or not they use this tool. And I would think they would only use it in emergency situations because they needed to in order to meet the needs of residents. So that's why we are not lowering standards with this bill from my perspective. We are, what we are doing is trying to assure that the board has the tools it needs in emergency situations to address the scarcity of providers. So I'm not as concerned about the precedent. I don't see it in the same way.
Delegate
Thank you,
Collison.
Madam
Delegate Saab, is your hand up again?
Yeah, well, I actually just want to say, I'm glad that the amendments are in, because I think it puts my mind at ease. And honestly, the reason that we do what we do is because we want to protect patients. And this is a serious issue. You're dealing with people that are vulnerable. So I'm happy that the amendments are in. I'm happy that hopefully we'll never have to need it. But mine is just more of a on a principle that I think if we have the boards, we should follow what the boards say. So thank you.
No, thank you very much for this nice discussion. It has been moved and seconded, and it sounds like we're going to have a divided vote on this one. So I'm going to have all in favor say aye, but if you would like to be recorded in the no, we'll put your hands up and then we'll count and see how it goes. So all in favor say aye. If you're no, let's make sure your hand is up. I see Delegate Riley, Delegate Saab, and Delegate Morgan. Delegate Krebs is not here, but I know that she also would like to be recorded in the no, although she's not going to be recorded because she's not here, but I believe she is of like mind. Delegate Landis is also in the no. So that gives us 1, 2, 3, 4 on the no, and 1, I'm counting heads, 2, 3, 4, 5, 6, 7 on the yes. So it will come out favorable but with a divided vote, and we will continue to discuss this. Thank you. Pretty efficient, 12:16. Lisa, thank you for your help with this. And let's move on to the Lindsay bills. We're going to try and do what we know can move quickly. So let's do the massage therapy, Senate Bill 37, Senator Augustine's bill, which we passed out of this subcommittee and committee unanimously. We put an amendment on for educational requirements, for credentialing of the educational requirement. And then the Senate actually changed the penalties. So Lisa, why don't you tell us where we're at with this so that we can make sure we're all in agreement.
So the Senate
Not
bill
Lisa, sorry, Lindsay.
was fine. The Senate bill, as Delegate Kelly mentioned, came through with a couple of differences from what HGO had done on this same bill. And to remind everyone, this is the bill that phases out the registered massage practitioner credential. So what the Senate bill did, and I circulated a reprint that would show proposed amendments that this subcommittee could adopt. The difference here is on page 4 and page 6 of the reprint. The HGO committee adopted amendments that require the curriculum of the institution of post-secondary education from which an applicant has graduated to be both endorsed and accredited, and allowed the accreditation to be only by an institutional accreditation agency recognized by the U.S. Department of Education. That was a suggested amendment from MHEC, and that was not adopted on the Senate side. So what you see here on pages 4 and 6 is suggested amendments making that change to conform it to the way HGO passed the bill. The other change that Kelly just mentioned is on the final page, page 8 of the reprint. The Senate reduced the civil fine for practicing without a license from $50,000 to $10,000. I left that in place, subject to your discussions on that difference. So if you leave it the way the Senate did it, you would not be changing that by amendment. If you wanted to change it, then we can do that.
Okay, Delegate Saab, you have a question?
No, I'm sorry, my hand was.
Oh, your hand is still up.
Thank you.
Okay, so the amendments, Delegate Bagnall, go ahead.
Just a quick question as we're about to discuss the civil penalties. Can you just remind us, is that consistent with other penalties for other providers? for other professions?
The folks from the massage board are here, they might be able to speak to it, but as I recall, I think there's a dozen or so other health occupations boards that have a $50,000 civil fine.
Okay, thank you.
I saw someone from the massage board here and now I see her gone now. Is she still here or is she in the waiting room? If not, we can have Moira Cyphers or Amelia Mitchell weigh in on this. You guys agreed to this amendment in the Senate, right?
Yeah, Amelia Mitchell, American Massage Therapy Association. We agreed to it in the Senate. It is lowering what is kind of the standard for other health boards, many of which are up at 50,000, which is why we originally, not the board originally put it in at 50, but this is not, the board basically was happy with it from everything that I have heard, and AMTA has no issue with this change from the Senate.
So not a deal breaker.
not a
the
deal
massage
breaker.
board is here. My video somehow is turned off.
Oh, excellent. Welcome.
Yes,
Welcome.
yes.
Go ahead.
Yes, I'm Sharon Oliver. I've been here and it's telling me that the host has to allow my video feed. And Amelia is correct. The board is not in opposition to the reduction in the feed.
Excellent. Thank you. Delegate Bandari. Oh,
Thank
there's
you,
your video.
Madam.
Welcome.
Yes, it's back on. Thank you.
Thank you, Madam Chair. It seems like they work really hard. I think we can concur with this and move the amendment. I would like to
Excellent.
move the amendment.
Moved and seconded. Any further discussion on the amendment? All in favor say aye. Anyone who's opposed, raise your hand. I will ignore Delegate Bandari's hand. And the bill as amended.
So moved.
Second.
Moved and seconded. Any further discussion? All in favor say aye. Anyone who's opposed, raise your hand. Okay, passes unanimously. Way to go. Thank you all.
Thank you.
Next up, we have Senator Feldman's bill. We just heard this yesterday. Senate Bill 144, Health Authorization to Prescribe and Administer amygdalin, I believe it's called. Lindsay.
This bill repeals provisions governing the prescription, administration, and regulation of amygdalin to treat cancer. As Delegate Kelly mentioned, this bill was heard yesterday by the subcommittee. There wasn't a cross file, so you haven't seen a House bill on this. There was no opposition and no proposed amendments.
Okay, and Dana, are you here on this or no? Nobody's here on this.
I'm
Steve
just
Weiss,
watching.
maybe. Steve, are you here on this? Is anybody here on this? It seems like a straightforward bill. Go ahead, Dana.
Here. Yeah, no,
Okay.
I was just going to say MedChi and the Maryland DC Society of Clinical Oncologists supports.
Excellent. Delegate Saab and then Delegate Cullison.
You know, I actually missed the hearing yesterday, but I did a little research. But you know, I grew up eating apricot seeds, so I'm glad Senator Feldman brought this to our attention, so I can stop doing it. So thank you.
All right, Delegate Cullison.
If I'm understanding the bill correctly, it's just taking this drug out of the Maryland legislature, which has already been withdrawn from the FDA. Am I understanding correctly? Can I move this bill, please?
Absolutely. Moved and seconded. Okay, perfect. Any further discussion? All in favor, say aye. Anyone who's opposed, raise your hands. All right, passes unanimously. Go team. Now we have just under 10 minutes to discuss this bill we've been discussing all session, which seems to get more complicated by the week, which is House Bill 462, authorized prescribers. And I believe, I see Matt Dudzik here. I believe someone was here from Chairman Kelly's office. I'm not sure if she's still here. I see Dr. Assi here also. There's Linda Forsythe. Sorry, Linda Forsythe is here. Thank you. I'm glad you're here with us. I'm going to have Lindsay remind the committee of what the bill does. We did just hear Chairman Kelly's cross-file of this bill this week also. Go ahead, Lindsay.
So we've got both the House bill and the Senate bill. As originally introduced, the House bill, I'll start with, requires each authorized prescriber who receives a financial gratuity or incentive from a pharmaceutical distributor or manufacturer to file a financial disclosure form with the Health Occupations Board that licenses the authorized prescriber within 30 days after the financial gratuity or incentive is received. The Senate bill adopted amendments that this subcommittee also discussed for the House bill that sort of bifurcates the bill for authorized prescribers other than physicians and for physicians. That bifurcation of the bill was based on the fact that physicians are currently covered, so to speak, through the CMS Open Payments website. If you go on their website, you can look up the financial gratuities that physician prescribers have been receiving. As we all learned in subcommittee last week, there's been a change to the CMS regulations so that that website will start including other types of providers. So that bifurcation for physicians is maybe not so necessary. But the idea was to bifurcate it so that there were authorized prescribers other than physicians and then physicians. The physicians portion of the Senate bill allows for a link on the physician's profile to the CMS open payments website so that someone viewing the physician's profile could look up the financial gratuities that that physician prescriber has received. The amendments also require for both the physicians and the other boards that if an unauthorized prescriber has been cumulatively receiving financial gratuities in excess of $5,000, that the board should look at the prescribing history and patterns of the authorized prescriber, essentially to see if it appears that their financial gratuities have influenced their prescribing.
Okay, so let me give the committee an update to the best of my ability, because we have been discussing this and we were sort of working towards some kind of ability to meet the goals of the bill. And there've been a lot of folks here trying to work towards that goal. I don't think we're quite there yet, but I guess we can sort of let's start with Linda. Did you want to add anything from the chairman? I know when she presented the bill in HGO yesterday, she was asking us to not adopt the Senate amendments. So why don't you give us an update there? Because I think what our subcommittee was working on last week was creating a solution similar to the Senate amendments for those other prescriber classes. And that's sort of the path that we had been on.
Yeah, so we got two sets of amendments or proposed amendments that were sent over. And Senator Kelly's position is that the original specifications for the bill provide the most efficient and least expensive, because that's why the fiscal note went up to do all the other things that were added in the way to get that done. And yes, while the federal database does include physicians, it's an unwieldy document. And that's also to make somebody go in and just look through all of that is nationwide, it's not localized, which is also what made the costs go up. And I guess the other thing for the open payments program that began in 2014, and the articles that were included in her testimony, as well as I think Delegate Pena-Melnick's testimony, were all after 2014. And they all talk about how billions of dollars have been going to physicians regarding prescriber for medicines and medical devices. So that's her point.
So that is helpful, but I believe, and tell me if I'm wrong to the stakeholders here, if we were to not adopt the Senate amendments, then we would have MedChi in opposition along with the other provider groups who don't know how to comply. Is that correct, Steve? Can I speak? You came into the original bill hearing with concerns and suggested these amendments, right?
That's correct. And we supported the changes that were made in the Senate. And what you just said is correct. If it were to revert back, we see that as basically redundant reporting, where physicians who met the criteria in the bill would be reporting information to our Board of Physicians that is already publicly available. And under the amendment that the Senate adopted that we supported, you could go into Dr. Jones's profile on the Board of Physicians, and you would get a link directly to the gifts or whatever you want to call them, gratuities that Dr. Jones got. So it really does localize and simplify getting to what your doctor, your physician received.
And is there, Steve, before I call on Dan, who I know has an interest in this, right now the situation is different with physicians and other provider groups. If we were to add the provider groups in, because the physicians have some sort of unique profile, but the other providers don't. Can you explain that a little?
Correct. There's two things at the moment that are unique about physicians, and that is we have been covered by the federal database, but as was already mentioned, that's about to change. And then the other thing that's unique about physicians is on the Board of Physicians website, you can look up any physician to see if they are licensed in Maryland, but they have a link, they call it a profile, which the legislature required a number of years ago, that provides other information like education, malpractice insurance, and that is unique to the Board of Physicians. Our view would be, if you're going to follow the same pattern for these other authorized prescribers where they could get this federal information the same way, they're going to need a similar profile. I know that opens up other discussions, and the boards would have to create that, but it has been done. The Board of Physicians does it. And to us, if this is important information for the consumer from a prescriber, it doesn't matter whether that prescriber is a physician or a podiatrist or a nurse practitioner, it's the same important information. So I'll leave it there.
Okay, and I'm going to call on Dan and then Matt Dudzik and then Delegate Saab, and then we're going to pick this up again because I don't think we're going to get there this week. Go ahead, Dan. Dan Doherty.
Thank you, Madam Chair. Dan Doherty on behalf of the Maryland State Dental Association. First of all, with respect to Senate Bill 159, as it has come to you from the Senate, my client totally opposes it. It creates all kinds of problems, and we just feel it is inappropriate. With respect to the original bill and the way House Bill 462 is, we were in a sort of no position originally, but there are two issues that if you're going to take that more simple approach that we think needs to be addressed. First of all, we think raising the amount as suggested by the Board of Physicians and as is contained in the draft language we got from Lindsay from 5,000 to 25,000 makes the most sense. Secondly, the frequency of reporting every 30 days is really kind of onerous. It causes problems. I mean, a dentist could be on a trip to Europe and get a gratuity for a speaking engagement coming up and wouldn't be there to report. I think it ought to be more in line with the kind of reporting we do as lobbyists and you all do as legislators every 6 months. I think that is sufficient. I think it is less burdensome. And finally, we would be fine with the amendments language that was circulated from the subcommittee through Lindsay. That is something that the association is fine with. I will note that I am sure it does cause some problems for the State Board of Dental Examiners, and there might be a need to have a phase-in period before it takes effect. But that approach, we think, avoids duplication in reporting. It raises the threshold, and it has a lot of provisos that I think accomplish the intent of the original bill.
Thank you very much. Matt Dudzik, thank you for working on this all week.
Thank you. So I just wanted to clarify a couple of points. First, regarding the federal database, I will freely admit it is an unwieldy database. It's to download the full database is about 4 gigabytes of information. It's a big database, but they do allow you to download it. You can download it as a CSV file. So I was able to download it and was able to put it into Microsoft Access and get it to produce specific information. So for example, I was able to get it to produce physicians with a Maryland license who received a cumulative total of $5,000 or more. That aspect is not what has prompted the raising of the fiscal note, because we did have to put in a higher fiscal note. The reason that we put in a higher fiscal note was related to the language that was added in the Senate Bill 159 amendments that said that for all physicians or all practitioners who received a cumulative $5,000 or more, that we would have to do a review, including a review of the prescribing history and patterns for all patients for that licensee. As I said, I pulled this data for 2020. There were approximately 619 physicians that received a cumulative $5,000 or more. We don't just have prescribing data. When we're in the course of an investigation, that is something we have to subpoena. So we would have to, in this case, issue more than 600 subpoenas. We would have to then have our analysts or investigators review tens of thousands of patient records. in a year. I am certainly not arguing that we can't do that. Of course, it's something that if that is the will of the legislature, we are happy to comply with. But we did want to make it clear that that would require the hiring of additional staff. So that is why the fiscal note went up. It was not a question of the inclusion of the CMS data. If anything, that was a step in the right direction because it means it's a one-time technical solution versus creating an ongoing infrastructure to accept these financial reports and store them, which would also require some IT involvement. As far as the amendments that were circulated, we did try to kind of take into account what a lot of the other health HOC boards were saying. Because I will say there's two things. First of all, with the CMS database, number one, they added a number of professions in 2021. That data will be available in June of this year for all 2021 data that involves nurse pracs and physician assistants and other professions of relevance. But I'll also note that the CMS definition of a physician actually is a different definition than we use here in Maryland, and that includes doctors of podiatry, doctors of dental medicine, and it, I believe, also includes chiropractors and optometrists as well. So there actually already is, within the existing CMS database, there are a number of other professions beyond just physicians. So I did want to kind of point that out. Data is not actually newly being added, it's already there. Regarding the recommendations that the board recommended, number one, getting rid of the all patients language. We just think that is a very, very high burden. And of course, if we have to go to a full investigation, that's probably something that we will end up needing to look at, almost certainly. But in the case of just doing a preliminary review to determine whether we are going to move forward with a full investigation or determine if there's a violation of a state or federal law or anything of that nature, we feel that that is too high of a burden for that initial review. The other thing was the raising of the thresholds. And I apologize because I wasn't able to do an exhaustive search. Part of that is because we're still facing database issues, so we couldn't look through all of our records. But I did look through as many records as I could find involving similar cases. And the smallest amount that I was able to find of a doctor who would face violations for this was a doctor. We just recently took action in 2021. It involved that doctor also received violations of the federal anti-kickback laws. And that doctor was it was related to accepting, among other things, and there were other issues with this doctor, but among other things, that doctor was accepting contributions from or financial gratuities from a company, Insys Therapeutics, which makes a sublingual form of fentanyl. That doctor was receiving in the periods that this was at issue, was receiving over $70,000 a year. And that was the smallest amount of, kickbacks that we were dealing with. And of that 70,000, 32,000 came from this one company, Insys Therapeutics. So that's how we came up with the suggested $25,000 figure. We just believe that it would be a more appropriate threshold. And of course, we would still have this information publicly available. So we still have the ability to investigate in any case. We still have the ability to investigate when there's a complaint or when there is another action or a federal action that takes place. We can still move forward and investigate. This would just be what triggers that automatic review. And from a numbers
Thank you, Matt. I love you, Matt. You could talk forever, and I promised the committee they'd be at lunch 9 minutes ago. Saab, ask your question quickly.
Actually, Matt answered most of my questions, so thank you.
Perfect. So we are obviously going to come back to this conversation. There's a lot going on here. Hopefully we'll make some progress over the next couple of days and come back to it. Pat, I see you here. Is there any, if you have something to add, I assume you're going to tell us do the right thing. Consumers need some protection here, something like that before we adjourn.
Very quickly, the ethical duty of a prescriber is to do no harm. We have 10 years worth of evidence of the financial and physical harm that results from adverse influences on prescribing practices due to these payments that are made to many, many prescribers. We believe the solution to the resource issues that seem to be flowing from some of these suggestions can be solved by having those who accept the payments, and they need not accept them, but those who choose to accept the payments should pay an add-on fee as part of the licensing process. And that is the solution. And that is what consumers would, and that is what consumers would expect this body to do to protect them. And to suggest that $25,000, to suggest that $25,000 is the amount under which prescribers can accept payments without any harm to patients, we object to that suggestion. Thank you.
Thank you so much. We will pick this up again next week. Thank you to the members of the committee for your patience. Happy birthday, Delegate Collison. See you soon.